Hey, Ginger, thanks for joining me. I wanted to just interrupt. I know your very busy schedule and talk about some of the things that we were chatting just the other day about of what I do, but more importantly, what you do. So if you could kind of tell us all what's your background and what do you do?
Hey, Robert. So I'm an ER physician now practicing in Colorado. And I locums in different state, but obviously I do my most work in Colorado, and it's a hot spot right now. So
Wow. Well, obviously, you're very busy and you're certainly on the front line. You know what I do in real estate. So, if you could kind of give some advice to real estate agents and maybe how it applies to anybody who's interacting in either a capacity of coming into your house, a contractor, a plumber, anything emergency that you have, what would you recommend to us service professionals right now?
yes, so this is a great question. Obviously, the COVID-19 has got us thinking differently about viruses and bacteria. And it's no longer just this hygiene mentality that the healthcare workers need to take on. It really does need to extend into the real estate businesses or anyone entering to your personal private spaces.
Mm.
So, the things that I would first recommend is when you are wanting to bring your clients into a home or your client is the homeowner, then the number one recommendation is let's do a pre-screening on your clients. That's something maybe, I mean, definitely we've not done before, but to reach out to both of them and make sure there's not been an illness in the home that is to be viewed, anything within about a 7-day time period, or that any of the clients have had an illness. And these symptoms would include anything with a fever, flu-like symptoms, and in regards to the COVID-19, we're even extending into GI symptom complaints. If you can do
Okay.
that first pre-screen, if there's an illness suspected, delay the viewing for at least a week or until the people are symptom-free by 3 days.
Okay.
If there's no suspected illness, then that can go into the next step that we would take to view a home.
Okay. So obviously, with clients, we're trying to do our best with virtual showings using FaceTime, video, Skype, etc. But what if they, really want to see the property, and of course, the sellers are allowing it? What should we be keeping in mind and doing when we're in the property, maybe leaving the property?
Yeah, so definitely virtual screening. I mean, those are great, but as for me, I would like to see a home. So then the simple procedures to take, and it's what every CDC as well as all of your state health departments are recommending, is to take the first step of making hand hygiene.
Mm.
So when you have a client come into the home, the mentality of real estate agents now or contractors now need to be looking at the home as contaminated. So you want to first have the clients put a hand sanitizer on. You rub it in until it's completely dry. That reduces the germs of which they are bringing into the homeowner's house. As they view surfaces, that's given them clean hands.
Hmm.
The second level of protection is then clean your hands when you leave the home, and
Okay.
that's protecting the viewing clients with it.
Sure.
So those are just simple hygienes to recommend. I do like the idea of shoe booties
Hmm.
just because there's a lot of germs, not COVID necessarily, that are brought into the home with shoe wear. So either remove the shoes or put like a shoe booty on, and those will also protect both people as well. It's a simple task. It's hand hygiene that everybody can take.
Well, I love your idea of the pre-screening and of course sanitizing. I've got Clorox wipes that I've used when I wipe down surfaces that I might have touched, and certainly, the post viewing of the property, doing another hand sanitizer or washing of your hands is even better. So, like you're saying, this is applicable to not just our industry, but all contractors that would come interact with a house,
Yes,
because that's
yes,
where we're kind of all stuck right now. But
yes.
I really do appreciate your advice. Anything else that you'd like us to know right now?
Well, just as you brought up, in regards to hand washing, then an advice for the homeowner would be then probably doing just a wipe down on the main surfaces that are most typically touched.
Hmm.
I had, as we had discussed, what a great process you had already done as an agent to go back out of courtesy and help with the cleaning in the home. But if not the agent, then definitely I always advise the homeowner to go back in and just clean those surfaces. That's just a general good hygiene.
Yeah. Okay. Well, Dr. Smith, please know that we're praying for you. You're on the front lines of this, and we're so thankful for your service, not only locally, but certainly to this nation, so that we can wipe this out and hopefully get back
Yeah.
to a normal that we so enjoyed. So we'll be praying for your family as well. Thank you again for your time.
Thank you very much.